Assalamu alaikum and very good afternoon to all of you. Respected teachers and colleagues, may I request all of you in my today's presentation. Today my topic is Complex PCI Toolkit. I am from Square Hospital. I am Dr. Khondoker Asaduzzaman. And let us see what are the complex PCI toolkits. We can classify the complex PCI toolkits into 4 headlines. You can see here the pre-lesion crossing tools, number 1. Number 2, lesion crossing tools. Number 3, post-lesion crossing tools. And number 4, bailing yourself out the tools. So, pre-lesion crossing tools are the sheaths and guides. For most of the cases, in case of femoral, we used for complex PCI 7 friends, and for radial, definitely 6, and sometimes we use the 7 instead of 6. We use actually the glide sheath slender, which is compatible for 7 French guide catheter, and the guides basically there are 6 French is compatible for most of the PCI transradially, and sometimes we use the 7 with the help of slender sheaths. The selection of appropriate guide catheter actually is the single most important step, and large lumen guide catheter is often used for complex PCI, particularly if you plan for double stand status, if you plan for KBI, or if you use for bulky devices. And lesion crossing tool sets are guide wires, microcatheters, and sometimes for CTO lesions, crossbars, stingray, and you must have some facilities of intracoronary imaging. And what are the post-lesion crossing tools? These are of 2 types. One is lesion modifiers and another is device delivery. Lesion modifiers tools are cutting balloon, scoring balloon, OPN balloon, IVL, and obviously atherectomy. And device delivery, these are the guide liner or the guide chiller. And what are the bailing out tools? First, the percutaneous synthesis kits, snare, cover stand, coils. Cover stands definitely you particularly use for the large vessel perforation, and coils for the small vessel or micro vessel perforation. And this is the scenario of the guide wires. And we should start from the workhorse wire, then we split our wires, and we should consider the very hard wire, particularly in the situations, and we can consider the stepwise approaches of different wires. And let us see the use of hardware with the help of microcatheter. And you can see here the situation is crossed with Miracle 3. And the microcatheters, there are different types of microcatheters. Most commonly used in our country is the fine cross and corsair. And the advantage of it is controlling the subintimal tracking in case of retrograde, and you can use the traverse, the collaterals for the situations. We can use the contrast to see the distal run of the vessel. We can took the help of microcatheter for the crossing the situations, and we can easily use the microcatheter for exchange of different types of wires as well. And you can see here the use of microcatheter. With the microcatheter, we can exchange the different types of wire, and we can easily cross the situations. And these are the crossbars and the stingray for the situations. And the Guidezilla. Guidezilla extension catheter is an effective and safe tool that provides improved backup support and increase the success rate of PCI for complex lesion. And there's the use of guide extension catheter. And here's the use of IVAS. IVAS provides very interventional lesion characters, and to the post-interventional stand deployment results. You can see here is the very tight lesions in the L6 ostium, that is the ISR, and it was checked by the IVAS initially, and then after putting the stands, we cross-check the IVAS. And IVAS should be used in almost all complex coronary lesion for improved clinical outcome. And this is the scenario of all the devices for lesion crossing: CTO balloon, rota, IVL, guidezilla, guide catheter, and IVUS in a frame. Here you can see there is a near CTO lesions in the RCA, but wire is crossed, but balloon was difficult to cross. If you have any low profile, that is the CTO balloon, just like 0.8 millimeter or 1 or 1.2, then you can easily cross this types of lesion. Otherwise, you may fail to cross the lesion or you may abandon the procedure. And you can see here, after crossing the lesion, the result was good. And there's a different issue of cutting or scoring balloon. Basically, the complex coronary lesions interventions can be benefit from pre-treatment with scoring or cutting devices to minimize balloon slippage, alter calcifications, increase artery compliance, and enhance the stent delivery system. You can see here in the video on the right side. And there is another device that is atherectomy. The rotational atherectomy has been the most widely used atherectomy modality till now. And you can see here the lesion character and the use of atherectomy devices here. And now the bailing yourself out. And what are the procedural complications in complex lesions? Acute vessel closure, coronary perforation, cardiac tamponade, stent loss, undeflated balloon, and have easily available in your hands percutaneous kits, cover stent, coils, and ventricular assisted device in some centers also. Let us see the stent dislodgement, retrieval of the stent dislodgement here. And now you can see here the perforation. Actually, this case happened in just day before yesterday in my lab also. And we minimize the lesion, that's perforation, by using the cover stent and then put another stent. And there is another complications just after stenting. Just post dilatation is the higher size of balloon. You can see here the perforation, and this perforation was minimized or managed by using the prolonged balloon inflation, and definitely percutaneous synthesis was done in both the cases. And here is just after deployment of the stent, and it was a very tight lesions. Stent was deployed, but post dilatation, just during the post dilatation, balloon was undeflated. And what should be the next? There are different maneuvers and of retrieval of the undeflated balloons. And now the conclusions. Complex angioplasty procedures has to be performed as a planned procedure to improve the success rate and to avoid procedure-related complications. Selection of appropriate devices is the most important step that determines the success of a complex interventional procedure. Many devices may evolve and more tools are on the pipeline to overcome the challenges. Know your kits and constantly update your knowledge for appropriate use of toolkits. Thank you all. Thank you for patient hearing.
Thank you, Dr. Asad. Any questions?